On Talk 100.3, I'm Neil Oja, and this is Talk Health. And joining us today on Ask FUH is Dr. Tommaso Tufo, who is a consultant neurosurgeon from the Fakeeh University Hospital, Dubai Silicon Oasis. Dr. Tufo, welcome to Talk 100.3.
Hi, good afternoon. In Italian, I will say buon pomeriggio.
Buon pomeriggio.
Buon pomeriggio.
Brilliant.
Good afternoon, and thanks to invite me.
Right. So, first thing first, when I thought of a neurosurgeon coming in to have a conversation with us over here, I thought someone who would be extremely serious. Someone who would just be a man of few words. Someone who would say, yes, I'm a neurosurgeon. Yes, I work with humans' brains. I work with something that's very critical. But then you sound to be a fun person.
Yeah, yeah. Just because I'm here today with you, but of course, my job could be quite stressful because neurosurgeon sometimes is involved in some critical condition like trauma sometimes or tumor. And but on other hands, we can treat other conditions that we can say less critical too. So that's why I think our job and our life is divided between some more serious, period and something more relaxed. Yeah.
Right. I mean, if I'm getting it right with your accent and the way you're speaking, you're from Italy.
Yes, exactly. I'm Italian, so I spent in the last 12 years as a consultant in the Catholic University of Rome, and I worked there covering adult and pediatric cases, basically.
Right.
I had part of my training in the UK and Brazil too, so I cover brain and spinal cases. That's my specialty.
As a neurosurgeon, there are a lot of people who think, and are probably scared, even I was, to think of a neurosurgeon, that the first thing, if I go to them and if I have a problem in my head, they will crack my skull open and look into the brain and say, there's nothing there. So, what does a neurosurgeon do? If someone comes to a neurosurgeon, what do they do?
Okay, so this basically I can say this we are not so scary, and I can say in the last 20 years everything changed in terms of in our practice. New technology, new equipment changed a lot on because now with the new technology, advanced in technology and the instruments, we can perform procedures and the surgical procedures in a minimal invasive way.
Okay.
So with a faster recovery for the patient, with the little scars sometimes. So we are moving in this direction too.
This is amazing. I mean, I'm glad to know that one does not need to really worry when they go to a neurosurgeon because they've got the solutions. And so, for what all reasons do patients have to come to neurosurgeon? Are they the first point of contact, or are they somewhere in the middle in the treatment cycle?
So basically, neurosurgeon is involved in different conditions. So we cover conditions like vascular condition for the brain. You can imagine aneurysm, malformation, vascular malformation of the brain. Of course, disease as brain tumors. And benign and malignant sometimes that needs to be managed with in a multidisciplinary team. But we treat two condition as pain, so spine condition, so degenerative spine condition, nerve compression, and some peripheral nerve disease. It's a kind of, this not an easy field because we cover different conditions. Of course, we have some subspecialties. It means some surgeon has particular interest in some particular field.
Right. This is amazing. Within the span of the last few minutes that we've already spoken, you have given us a window into what a neurosurgeon does, and what all reasons are there for a patient to actually come and visit a neurosurgeon. But as you mentioned, that be it the brain, be it the spine, and multiple issues therein. The first question that comes to my mind is that, like for chest pain, I know that my chest is hurting. I might have an issue with my heart. I've fallen down. I have a swelling in my arm. It looks like a fracture. I'll go to an orthopedic surgeon. Does a patient get to know that he really needs to go to a neurosurgeon, or is it always recommended by a family physician?
Sometimes the family physician is really important because there are some urgent conditions like headache or patient vomiting or loss of conscious, of
Mm-hmm.
course you have to refer to the ER and do some urgent investigation and rule out some intracranial, sometimes bleeding or intracranial issues. Other conditions, they can be sometimes pain and chronic pain condition from your spine, neck pain, lower back pain, leg pain, these kind of things. So this is sometimes the where the neurosurgeon is called, to investigate and to check in this kind of cases. That's just speaking about the more frequent condition. Of course, there are other conditions in pediatric patient like some skull malformation. Sometimes
Mm-hmm.
there is involved the neurosurgeon too, or peripheral nerve compression in case. That's all, of course, they are all under this kind of umbrella of pain, basically.
Right.
Yeah.
The question that came to mind was, you always wanted to become a neurosurgeon, or it was that, yeah, let me just try this.
Yeah, I think that's really a good question. So it's I started thinking about this when I was really young.
Mm-hmm.
It was not easy, but I can say I was always focused on this kind of career, and I can say after that I achieved the
Wow.
goal, and I'm really happy for this. You need lots of sacrifices sometimes, but I'm happy for my career, I can say.
I'm really glad, that there are more and more neurosurgeons who, at a very early age, like you, think that they want to become a neurosurgeon because, it's a very critical job. And, the more neurosurgeons we have, the better. Now, in our last conversation, you mentioned about back pain. Everyone literally here in the UAE drives plenty of hours every single day. There are people who are driving from Sharjah to Dubai, Sharjah to Abu Dhabi and back, 3-4 hours in the car in the same position, sometimes in traffic. The back does give up at some point in time. And then we generally tend to say that, it's just because I've been sitting for long hours. No problem, I'll just stretch myself and I'll be sorted. But could that be the beginning of something really big that a neurosurgeon like you could say, listen, you need to take care of that?
Yeah, that's really a good point. The fact we changed, I can say, our lifestyle a lot in the
Mm-hmm.
last 20 years, and spine basically is quite affected by this. So it's not just like this. Sometimes our body weight or trauma sometimes. So and we can say 70% of my patients they refer to my clinic for lower back and neck pain. Of course, there are you need to have a sort of program for this kind of condition because you can say 80% of lower back and neck pain they can be treated in a conservative way.
Mm-hmm.
So you need to be, of course, after a physical examination, you need to be sure that there are no issue in terms of power and sensation in the limbs or other condition that could be emergency condition. After that, is important to have a plan. Of course, it needs to be some changes when it's possible in the lifestyle and some physiotherapy and medication. But we can say between 10 and 12% of people
Mm-hmm.
with this kind of condition, they can go ahead and they can have an worsening.
Okay.
And then in this phase, we need to go ahead with more investigation sometimes and check what's happening. And in that case, there is the role of a neurosurgeon is crucial, is important.
Right.
Yeah.
So you mentioned that, trauma. So trauma could be probably because of an accident or a sport injury. A lot of people over here play a lot of sport. Could it be that you're playing a contact sport, you're probably playing rugby, you're doing boxing, or you just got into a friendly brawl with your friend and he smashed you down, and then the back comes into play. What could be the possible outcome of a traumatic case of back injury?
Of course, we have to check two things. Basically, as all traumatic injury, you can have injury in the bone of your spine, basically, and you can have the injury sometimes in the nerves too. But I can say is a kind is common to have a trauma, but have a kind of severe trauma with damage to the nerve and to the spine is quite rare. Of course, in these cases is important if you have a serious trauma in your spine to refer to the emergency room and to check with the emergency examination and the radiological investigation if there is some issues. Or in other hands, if there is pain, continuing pain, and lasting more than 1 week, sometimes 2 weeks, is better to refer to the clinic
Makes
and
sense.
consult. Yes, yeah, and the neurosurgeon. Yes.
That's a fantastic point that you make over here. We are in conversation with Dr. Tommaso Tufo, who is a consultant neurosurgeon at the Fakeeh University Hospital at Dubai Silicon Oasis, and we're opening the lines for you just in case you have a question. We have a consultant neurosurgeon speaking to us right now. So 0586861003. That's our WhatsApp number. You can send in a message, ask your questions, and we'll try and ask them all. There are, you mentioned about lower back, but neck also becomes a problematic issue, especially in today's time and age where everyone is not looking forward but looking into their mobile phones. The postural changes, does it also impact the spine?
Yeah, the posture can impact the spine. That's why, but always you need to have a plan in case of spine condition, and always consider the physiotherapy as a first step. If there is no urgent condition like a nerve compression,
Right.
or a neurological deficit. That's why it's important to have an assessment before, because if you start sometimes with the treatments, lots of people start with the chiropractic and other things on. They can try to help themselves in the gym. They can make some damage if there is some issue. So it's always better have an assessment, a neurological or neurosurgical assessment, and be sure there is no urgent condition before starting sometimes some treatment in your spine, because the spine sometimes could be the cause of severe problems if you don't recognize this.
Very, very interesting point made there by Dr. Tufo. He said that, listen, don't try and self-treat yourself. Get a consultation done, understand what the problem is, and then there definitely will be a solution. Your questions will be answered 0586861003. Now, Doctor, in the break and a while before that, we spoke about something which is a specialty, a super specialty, and things where neurosurgeons' help is critical. We're talking about cases of patients who have epilepsy. What is epilepsy? Can we decode it for the people who probably haven't experienced it or probably have experienced it as someone who's an outsider? What is epilepsy, first up?
Thank you, and welcome back. So the epilepsy is a really frequent neurological condition, and this affect pediatric and adult patient. We know very well is a kind of incidence of 1% in the population. It means it's really frequent, and 30% of people, they can't control the seizure with the medication. That's why you need to explore other option. So neurosurgeon sometimes is involved in this kind of decision process, because neurosurgeon, in particular functional neurosurgeon, this is a kind of subspecialties, is involved in these treatments because there are some new devices, new technology, then they can control this kind of seizure with small devices implanted. So with small surgery, with small devices that can just deliver a small electric field in your nerve or a specific part of your brain, you can control the seizure. And there's something really important. This kind of technique, neuromodulation technique, that there is a new field of neurosurgery. So, and is not indicated just in epilepsy. There are many other neurological conditions like Parkinson disease, dystonia, spasticity, and chronic pain too, that they have indication for this kind of treatments. And sometimes it could be the best treatment for this patient that they don't have other options. Sometimes then taking medication with no effect and lots of side effects.
That's very interesting. You mentioned about a device that is put into your system that gives that electrical charge. How does it all work? Because this sounds like absolute rocket science that's happening inside the human body. So, science has rather taken us to that level where we understand the electrical discharge that has been sent into the brain that is controlling the seizures. This is phenomenal. Could you just break it down and simplify this for us?
Yes. That's why I won't just spend it 1 minute, less than 1 minute about functional neurosurgery. Functional neurosurgeon is someone that try to fix some function in the brain and the spinal cord that is not working properly. And this function sometimes is not working properly in cases like epilepsy or some neurological disorder like Parkinson disease too, but in chronic pain also.
Okay.
So basically with this kind of, there are different techniques, but neuromodulation try to interfere with this kind of circuits that they are not working healthy and in an appropriate way, to stop this kind of abnormal signal, because we know our nervous system is working with the signal, with the electric field.
Right.
So, and that's why with this kind of technique, new devices and the new technology is helping us a lot. We can interfere with these abnormal circuits and try to restore the function. This is something important. So we try to restore a function with try to make some interference to this system and circuit that they are not working anymore in a healthy way.
This is amazing. I mean, the more I listen to this, the more I'm amazed at the work that you do in helping people out of the problematic conditions like epilepsy and Parkinson's. You also mentioned about Parkinson's, right? Again, it's a degenerative condition, and in that case, how does a neurosurgeon come into play? And what are the chances of stopping the degeneration or probably reducing the effect of it?
So the Parkinson disease is a kind of emerging condition, especially in this region that is quite young region. But in other part of the world and in US and Europe could be another neurological condition quite frequent. Usually, you can control at the beginning with the medication the symptoms of Parkinson's disease, but sometimes when you just pass this kind of we call honeymoon at the beginning of the disease, you need something else to control symptoms of Parkinson's disease. There are small devices and the technique, deep brain stimulation, we call this, where you can implant small devices in the center of your brain where the group of cell was lost, because Parkinson's disease is a loss of group of cell essential for the function of our movement. With deep brain stimulation, we can control symptoms of Parkinson's disease. Of course, just this not for all the patient is they need to pass a selection, so needs is for really selected patient.
Right. In fact, we were talking about Parkinson's, the way you mentioned about stopping the degenerative cells from further degeneration. It's just amazing. I'm still trying to populate all of these thoughts in my mind, and my brain is already going on a hyperdrive. I can just imagine the amount of information that's stored in your brain. But there's a question that's come in, and that's from Horace. He says, hi doctor, fantastic conversation and great to know so many things about neurosurgery. Is there any way to fight epilepsy without medication, since most, if not all, have side effects?
So basically, the management of epilepsy is always, the first line of treatment is medication. Of course, you have to balance. When you have side effects or you tried 2-3 different medication, you have to think to something else. So in a drug-resistant medication epilepsy, there are some option for neurosurgeon with the neurosurgeon, like the vagus nerve stimulation or sometimes deep brain stimulation, as less invasive treatment. So that you have to consider. Of course, discuss this with your neurologist, and then again in a kind of multidisciplinary teams. The selection for the patient for this really specific treatment is always a result of a multidisciplinary team discussion. It means you have to discuss always with neurologists, neurosurgeon, and sometimes psychologists too, and to take the right decision. But there is, for selected patient, that's an option.
This is amazing. Thank you so much, Horace. I hope your question is answered there by Dr. Tufo, who is a consultant neurosurgeon at the FUH University Hospital in Dubai, Silicon Oasis. Now, there is something which is called as a chronic pain, right? Especially chronic back pain or other such injury-led chronic pain. How does one align that with a consultation with a neurosurgeon?
So, chronic back pain is a condition of pain lasting more than 3-6 months. So, it means sometimes people they come to you with multiple treatment and sometimes multiple surgeries to perform in their spine. Of course, spine is one of the most frequent condition for chronic pain, but we can have other chronic pain conditions like a headache, trigeminal neuralgia, or pain related to diabetes, for example. Why neurosurgeon is involved in the chronic pain condition? Of course, you have to rule out some issues with your spine. So it means sometimes you can find spinal stenosis, disc prolapse, slipping vertebra. So something that it means some mechanical issue in your spine. But most frequently chronic pain, you don't have this kind of finding.
Mm-hmm.
So what you can do? Of course, it's a kind of program. So it's always our treatment. They are a part of option. The first option is always try with the medication and the physiotherapy, and always some changes in the lifestyle when is possible. But then for chronic pain condition and sometimes for leg pain, that is really frequent condition after sometimes 20-40% of a surgery in the spine, you can have a persistent pain.
Mm-hmm.
You can consider neuromodulation again. So it means this kind of a treatment, spinal cord stimulation in particular, is a kind of implant of small devices, sometimes in local anesthesia, that they can control the chronic pain, giving some electrical impulse to your spinal cord. So there's nothing new. There's something that is present, so is more than 40 years that we know this kind of technique. Of course, the recent advances in technology, they made this kind of small pacemaker, we can say is really small, and we can implant with the minimal invasive approach. Of course, this condition is just for selected patient.
Mm-hmm.
That is usually patient that had multiple surgery in the spine, diabetes, that with the leg pain, or leg pain related to trauma. This is the most frequent condition that they can consider this kind of option.
Right. You mentioned about leg pain, and many of people over here that I've some of them have come across have this pain in the back of the leg that goes all the way towards the ankle, starting from their lower back, and they refer it to the sciatica. What is sciatica, and how does a neurosurgeon help in this?
Sciatica is pain related in a specific part of the leg. So there's usually 90% of this condition is due to a compression of the nerve in the lower lumbar spine. It means we can, and it's quite easy to have a diagnostic with an MRI scan performed to check if there is some nerve compression after, of course, a physical examination. That is usually useful to start this kind of a program. Of course, the first line of treatment is always conservative if there is no neurological deficit or emergency issues, because sometimes disc prolapse or issue in the lower back pain in the lower back spine, you can have some, we can say, surprise if there is a big compression of the nerve. Is not, you have to consider sometimes an assessment with the neurosurgeon and consider to treat surgically the compression of the nerve if it's not effective, a conservative treatment.
Right. So, I'm sure that when you do all of these assessments and these pre-assessed cases come to you, minimal invasive surgery is now the trend or the technology that has come through. Does the sciatica, or again the patients with multiple spinal surgeries who need to have those implants, do all of these come under the minimal invasive surgery?
Yes, now we can say minimal invasive procedures is a kind of a standard in neurosurgical practice. Minimal invasive, it means we try to achieve, the issue with specific instruments and equipment to reduce the scar, to reduce the tissue damage, and to make the recovery faster. And sometimes, so people, they can come back home sometimes after a couple of days.
Wow.
Of course, you have to consider there are different conditions that you have to rule out. So of course, for simple compression in the spine, like disc prolapse or spinal stenosis. The minimal invasive techniques is a kind of is the first option of treatment in case of not result from a conservative treatment. For chronic back pain, of course, and leg pain, spinal cord stimulation could be another option, but there's a kind of different kind of patient. Of course, with the minimal invasive techniques, it means small scar and really fast recover for the patient.
This is amazing. I'm so amazed at which the technology has moved forward. Science has taken leaps forward. Now, you mentioned while you were talking about Parkinson's that the degenerative cells with an implant, the degeneration is stalled. Is there a way through which through some implants or something, the processes of the brain can be increased? I mean, it's a very curious question because if something that is degenerating can be stopped, then I'm sure that something that can be achieved more with the process of the brain, and as we've studied and known that we only use about 5, 7, 10% of our brain processes.
There's a research field that is quite interesting. Someone was trying to improve the level of attention with some stimulation, of some particular area of the brain. The neuromodulation and the brain stimulation is a kind of new field of research, not just for disease like Parkinson, tremor of dystonia, but for other conditions like psychiatric condition too, and condition like depression or OCD. So is a kind of field interesting because you try to modulate the activity of the brain that is not working in a healthy way with this kind of electric field, small electric field. And with some technique, you can do this without any cut, with an external stimulation. But it is a kind of new field for research, and but there are some procedures that they are approved for some disease. Something else is still a research field, but there are really promising results from neuromodulation for a lot of the different disease.
Wow, this is amazing. The way you say this, that hey, these are in process and things will improve further. Obviously, it's an ongoing process, but knowing so much about the brain, knowing so much about the spine, how our impulses work, how the brain processes things, and how all of these electrical impulses change the processing of the brain. Do you think in probably a few years to come, or maybe a couple of decades, there could be processes or technology which, by stimulation of the brain or probably the spine, we could have better hand-eye coordination, better memory, better ability to recall what we had studied in our 8th class? Would all of that happen and probably make us into a superhuman?
Yeah, but honestly, what we are going in a kind of direction for restore function. These kind of things to improve function is a kind of interesting, but what we are trying to do is restore function. You can imagine people that they have stroke, that they can't move sometimes a part of the body. With this kind of technique and implants, we are trying to restore this function, because that's the key of the next generation of the medicine. To restore the function that we lost. We lost for a disease, we lost for an accident, we're trying to restore this. So I think that's the first thing we need to try to achieve. Then after that we can try to improve our memory and our function. But sometimes I think let's start with this, try to restore the function that is lost in our patient. That's the first step.
Brilliant. As they say, start learning to walk before you start learning how to run. Fantastic. Thank you so much, Dr. Tufo, for joining us today in this conversation. It was amazing. It was an eye-opener of many sorts. Considering the fact that, very little is known about what a neurosurgeon does. Many of us think that, hey, you go to a neurosurgeon as the last resort once, you have crossed all the areas of, medication or probably with your doctors or whatever. And then you eventually go to a neurosurgeon and then keep your fingers crossed and hope to the doctor that, things will get better, because these are scary operative procedures. But now the way you have spoken and opened up our minds to the world of neurosurgery and the way the future lies ahead of us. It's just phenomenal. Thank you so much for this conversation, Dr. Tufo.
Thank you, thank you. Grazie tante in Italian. Grazie.
Grazie. Thank you so much for joining us. That was Dr. Tommaso Tufo, consultant neurosurgeon at the Fakeeh University Hospital at Dubai Silicon Oasis, joined us today at Talk 100.3.